This is a resolution of the Board of Supervisors 2018-18, recognizing Solano County Board of Supervisors recognizing the month of January as National Eligibility Worker Month in Solano County. January has been designated as National Eligibility Worker Month. It's a significant opportunity to thank and recognize the commitment and integrity and professionalism of Solano County's eligibility and employment workers for their invaluable role they play in the lives of children, women, men, and families, maintaining and regaining economic and emotional and social stability. The county continues to work towards recovery. Some residents still face ongoing challenges of health care, food, nutrition, employment, and other needs for supportive services. But despite those obstacles, eligibility workers remain committed to making a difference in their lives. They serve by being compassionate, knowledgeable, and empowering their customers to work towards self-sufficiency. Eligibility workers explain a complex regulation governing various public assistance programs, and all the time providing these cost-effective services, strengthening families, improving the quality of life in the community, and upholding the county's core value, performing their work with integrity and excellence. Now, therefore, it be resolved that the Solano County Board of Supervisors does hereby commend and thank the dedicated eligibility and employment staff in the Department of Health and Social Services. The work they do for older and disabled adults is so important. They do this every day. And it's not just that we're recognizing them on January, but we want to thank them for the years they put in and every day that they perform these duties. It is tough helping people who need help. It's not an easy task. And they make it compassionate, as we said earlier, but they also bring the personal side to it and helping these folks. So I want to commend them and I want to thank them on behalf of the Board of Supervisors, but also on behalf of every resident of Solano County, because we never know when we'll be in that situation. Thank you so much.
Thank you, Chair Vasquez. I love these meetings because I don't know any of you. So it's my opportunity to get to know people that actually work in my department. I was thinking,
maybe you should take them all to lunch.
Maybe John, you should. Each year we recognize the work and dedication of the eligibility workers. But I was kind of thinking, a lot of times we don't know basically what the benefits and outcomes are long term in terms of those who we touch. What is the outcome basically associated with applications for Medi-Cal, really to provide healthcare coverage for low income? What about CalFresh, basically providing food security for families and children? What about CalWorks and Welfare to Work, providing opportunities to get back to employment? So I was looking at basically what some of the states are doing. Some of the states across the country have begun to look at what is the return on investment for having these public assistance programs. So Friday, I shared with the staff a study that was recently done by the Urban Institute, a leading research and policy institute in DC. Began to look at what is the return on investment for society in general for programs like Medicaid, food stamps, and cash assistance. So I just want to share a couple of tidbits of the research. It says that research shows that access to food, health care, and child care helps families not only while they're receiving assistance, but decades later. The rest of society benefits as well due to families' increased tax revenue. So a study was done in 2015. By age 28, children who gained access to Medicaid, also to state children's health insurance programs during the 80s and 90s, studies basically found out that they paid more in cumulative taxes, collected less in earned income tax credit payments, had higher wages than similar children who were living in places without access to Medicaid or basically health insurance programs. 3 studies looked at SNAP, which is basically in California, CalFresh. Basically, it said that CalFresh reduces food insecurity. Studies on children in the long term, children have basically adequate nutrition, are healthier, are more emotionally stable, do better in school, and are more likely to graduate from high school. Finally, 2 studies on childcare. Mothers who received help paying for childcare were 40% more likely to remain employed 2 years later and to experience wage growth than those who did not receive help. Finally, the studies indicate when families receive help paying for food, healthcare, and childcare, it frees up income for other purposes, such as housing and utilities, and stabilizes parents' employment, allowing them to earn more income directly over a number of years. So what I shared with the workers is that even though a lot of times you don't know basically what the long-term benefit is in terms of the assistance that you're providing, there is a return on investment, both short-term and long-term, not only for those who receive an assistance, but also for our society as a whole. The key is that we don't want people to become dependent on these programs for life. We want them to transition into the community to become self-sufficient. So I want to introduce Angie Struckman, who we recruited from Marin County. She's one of our new administrators. Come on in, help you, Angie.
Good morning. Again, my name is Angie Struckman. I'm an administrator with Solano County Employment and Eligibility Programs. I'm here in place of our Deputy Director, Angela Shing, who unfortunately couldn't make it today because she's out sick, and she sends her apologies. But this is a very important recognition event to her, and she wishes she could be here. There are approximately 400 staff working in the employment and eligibility programs, and we provide services to over 1 in 4 Solano County residents. Our eligibility staff work very hard to enroll individuals and families in health coverage, to provide cash assistance for food, housing, and other basic needs, and to support people in going back to work and going back to school. Staff are challenged by large workloads, constantly changing regulations at the state and federal level, and seeing and hearing the stories of families in crisis every day. However, to the individuals and families of Solano County, our staff offer hope, they offer kindness, and they offer the financial services and supports necessary to get back on their feet and to build a better life. We are thankful for our staff every day, but especially today, we wanted to acknowledge and appreciate all of our eligibility staff for the amazing work that they do. And I want to say that I'm very honored to do this work with such a great group of people. Thank you to the board for recognizing our staff and highlighting the positive impact they have on our community. And I would just like to invite our staff to come up and introduce themselves by name and position so that you can put a name and a face to this great work that we do. Thank you.
Good morning and Happy New Year to everyone. My name is Jennifer Medina, and I've been an employee with Solano County for 25 years in a couple days. Currently with Employment and Eligibility, and thank you for this honor today. Thank you.
Thank you for your service.
I'm Karen Trollinger. I've been with the county for 4 years. I currently do multi-program intake at the Vacaville office. Thank you very much.
Hello, good morning. My name is Isabel Bryce. I work at the Welfare to Work department in the Vallejo office.
Good morning. My name is Cheryl Boulay. I've been working with the county for just under 3 years. I'm privileged to work with the elderly and disabled population in the Vallejo unit.
Good morning. I'm Karen Valentine. I work in the foster care unit at the Beck Avenue office in child welfare, about 12 and a half years now. Thank you.
Good morning. My name is Lindsay Martin, and I work at the Benefits Action Center, where we handle all the continuing Medi-Cal and CalFresh cases.
Good morning. My name is Kristen Perez. I also work at the Benefit Action Center. Thank you.
Good morning. My name is Claudia Rodriguez, and I work as a multi-program intake worker in Fairfield.
Good morning. My name is Frances White, and I work for the multi-program intake in the Vallejo office.
Good morning. My name is Adam Burris. I work at the Beck office in the Welfare to Work unit, and it'll be 25 years on the 1st of February. Thank you.
And he represents the male population.
Lucky man.
Good morning. My name is Brandy Birchfield. Next week, I'll be celebrating my 5th anniversary with Solano County. I currently work in the Fairfield office in Employment Services, Welfare to Work.
Good morning. My name is Christy Surio. I'm with the Foster Care Eligibility Unit, Fairfield Office, and Child Welfare Services. Thank you.
Good morning, everyone. Maida Greenberg. I work at the Beck office in the Welfare to Work unit, and I'll be here 10 years for the county.
Good morning. I'm Sarah Tovar, Child Welfare Services Foster Care Eligibility, and I've been here 9 years.
I think that's it. We got everybody. All right. Okay. Can we get everybody to get out front? And then can I have the 225-year employees?
Thank you for your service, everybody. Yeah.
Is anybody more than 25 years?
Is there anybody?
Thank you.
Ladies and gentlemen.